Hello people, in this video let us look at the general anatomy questions that have come in anatomy theory paper in the last 5 years. Okay, so previous year questions last 5 years which have come from general anatomy final theory exam. So if you know these must be more than enough to pass. Okay, so let's get started here. Differentiate between tendon and aponeurosis. So basically tendon is nothing but the end of the muscle, right, which connects this muscle to the bone. It is more rope like. So it is a rope like structure extending from the muscle and connecting this muscle to the bone. So this is tendon. And what is aponeurosis? Aponeurosis is the same tendon which is flattened, then it becomes aponeurosis. So example we have to give now, right? So let us get started with example for the tendon. For tendon, the example is biceps tendon that you can feel in your cubital fossa, and then you have your quadriceps tendon which attaches to the knee joint, right? In that you have the patella forming. Okay, so these two examples you can give for tendon. For aponeurosis, you can say palmar aponeurosis in your palm, right? And you can also say lumbar aponeurosis. Okay, so palmar aponeurosis actually is from the palmaris longus muscle, if you want to mention that. Okay, so we are done with one PYQ of general anatomy. Okay, now let's go to the next one. One question they have asked here, MCQ. MCQ also can come in your theory final exam anatomy paper. Dermis of skin is, answer here is dense irregular connective tissue. Okay, dermis of skin is dense irregular connective tissue. Okay, next question. Which of the following is pneumatic bone? So pneumatic bones are frontal, sphenoid, ethmoid, maxilla and temporal bone. That is the if you consider the mastoid air cells. So frontal, sphenoid, ethmoid, maxilla, temporal. So here the answer is frontal. Okay, next. Erector pili muscle is supplied by, the one that gives you goosebump and your hair stands up. That is sympathetic nerve. Erector pili muscle is supplied by sympathetic nerve. This is what action? Pilomotor action of the sympathetic nerve. Okay, next question here. Which of the following is an example for hyaline cartilage? It is tip of nose. Tip of nose is hyaline cartilage. Okay, when it comes to the other options, that is pinna of ear, eustachian tube, that's your ear again, epiglottis, all these are elastic cartilage. Okay, hyaline is tip of nose. Next question please. Which of the following parasympathetic ganglion does not have a secretomotor root? Okay, so the answer here is ciliary. Ciliary does not have secretomotor root. Okay, the others will all supply glands. So this one will supply the lacrimal gland, submandibular will supply the salivary glands, otic will supply the parotid gland. Okay, so the answer here is ciliary. Next, this is the parasympathetic nervous system. These are the ganglions. Okay, move on to the next question please. From general anatomy. Okay, down here it is. 3 types of anastomosis with suitable examples. So what is anastomosis? Communication between neighboring blood vessels is anastomosis. So the blood that flows through this anastomose will create a collateral circulation. Remember, these blood vessels have to be neighboring. Okay, it will not anastomosis with something which is very far. It has to be neighboring. Communication between neighboring vessels, blood vessels. Okay, coming to the types, you have arterial anastomosis, that is between arteries. Okay, and then you have between veins, that is venous anastomosis. Then between artery and vein, that will become arteriovenous anastomosis. Okay, now let us come to the examples. Examples for arterial anastomosis, like here you have between the superficial and the deep palmar arch, right? So in the palmar arch, okay, that's what they've written here. Similarly in the foot, plantar arch, then circle of Willis. Okay, then coming to between arterioles, if it is between arterioles, then you can say coronary arteries and cerebral arteries. That is in the heart and brain also you have some arteries anastomosing. Okay, then coming to venous anastomosis, basically between the veins, correct? Similarly here also you will say arches of hand and foot only. Okay, same thing. Then coming down here to the arteriovenous anastomosis. Arteriovenous anastomosis, this is called a shunt. This has a special word called a shunt. Why will this happen? So if there is an organ and that organ has what and all it will have a artery, right, and a vein leaving. Between this, if there is an anastomose, this is a shunt, arteriovenous anastomose. This will be active only if this organ is resting. Okay, if this organ is resting and it is not doing anything active, then this blood can just go back like this. Okay, so this is a shunt. Okay, so one good example for that is you can say nail bed. Okay, nail bed you can say for AV shunt. Okay, nail bed you say, and there is a lot of details here. Basically what I want to say is for each of this question we have individual videos. You can go through them in detail. Okay, this is more like a quick questions, final year questions, previous year questions. We are just looking at all of them. Okay, then we're done with this. Next question, general anatomy that has been asked in the recent years. End artery is present in which of the following organs? Answer here is spleen. End artery is present in spleen. Okay, where are the other locations it's present? And what is end artery, by the way? So end artery means, here, go back one step. Yeah, so arteries that do not anastomose, okay, with the neighbors is called as end artery. So the best example are your eye, that is in your eye, the retina, then your ear. Okay, the ear. So eye and ear, best examples for end arteries. The other than that, you have the cerebral arteries also. Then you have the spleen, kidney, lungs, and metaphysis of long bones. So here in the options we had only spleen. So we have written spleen. Okay, we have chosen spleen in the MCQ. Next, what happens if these end arteries get blocked? Then there will be nutritional disturbance, result in the death of the tissue to which this end artery is supplying. So there can be an infarction, remember. Okay, so that is why what will happen if retina loses blood supply, then there will be blindness. Okay, because there is no other anastomosis to provide the nutrition. Got it, people? How is it going? General anatomy we are trying to cover in nutshell for you so that you will pass based on the previous year questions. Okay, next. The first bone to start ossifying is, the answer is clavicle. Okay, then anatomical basis for performing a lumbar puncture at the L3 or L4 interspinous level. Between L3 and L4, why will you perform lumbar puncture? The reason is at L1 level, the spinal cord ends, right, in this vertebral canal. What it is called at this level is the conus medullaris. So beyond that only you want to puncture, right, to get the CSF, etc. So they are asking you to puncture between L3 and L4 interspinous process. You can see the needle they have shown here. Okay, so you don't want to damage what? Conus medullaris. Conus medullaris, which is you can say you don't want to hurt the spinal cord, like that you can say. Okay, some people say you can do between L4 and L5 also. Next question is on the blood-brain barrier. It has been asked multiple times. What are the components of blood-brain barrier and explain its importance? Okay, components of blood-brain barrier, let us say. See, this is another time this question has been asked. Components of blood-brain barrier, you will say the endothelium of this blood vessel has no fenestrations, that is no holes. So it will not allow the blood to just flow out or bigger things to exit the blood vessel. And also there are tight junctions in this endothelium. Okay, then the basement membrane of the endothelium also you should say. Then you can also mention one word called as pericyte. Some pericytes are there, and mainly you should say astrocytes, which are the ones which are covering the capillary walls. Astrocytes are your neuroglial cells, that is they are supporting cells. So they'll have some radiating processes which are covering the blood vessel, and they will allow only diffusion of useful things to the brain. Mostly it will try to protect the brain. Okay, so what and all it will not allow? Toxic and harmful substances it will not allow. Okay, that is what its intention is. Okay, so what are the components is what they have asked you, is the first part of the question. So you will say endothelium, no fenestrations, there are tight junctions in this endothelium, then there is a basement membrane, then you can mention the word pericyte, and mainly you should not forget the word astrocyte, which is a neuroglial cell. Okay, next. Where is this blood-brain barrier? Almost all part of the brain parenchyma, you can say. Where is it not there? Some places like hypothalamus and all, it is not there. Okay, because this Hypothalamus and all has to sense the content so that it will be able to produce and release hormones. What can cross the blood-brain barrier? Whatever the brain needs, like water, nutrition like sodium, chloride, potassium, glucose, all that it will pass. Then some oxygen and even carbon dioxide will enter the blood-brain barrier. Then all mostly lipid-soluble substances which are not very large in size will cross. Alcohol can cross. Anesthetics that your anesthesiologist will give, right? Even that can cross. So that and all you should remember. In starvation, ketone bodies can cross so that they will provide, there's no glucose, right? So at least the ketone bodies will provide the energy for your brain. Okay. Next. Okay. Who cannot cross blood-brain barrier? You write some toxins, pathogens, large molecules, non-lipid soluble, big proteins, all of these cannot pass. Okay. Even H+ ions cannot pass easily. It cannot pass. Okay. Clinical importance of blood-brain barrier, you will say, example, in Parkinson's disease, the person needs dopamine, which is a neurotransmitter, but if you give dopamine, it will not cross the blood-brain barrier. So to the patient, we're giving what? Levodopa, which can cross the blood-brain barrier. So this is the clinical anatomy of blood-brain barrier. Okay, people? Next. Classify neuroglial cells is another question that has been asked in the recent years from general anatomy. So in the nervous system, you have neurons, which are from the ectoderm, and then you have neuroglial cells, which are the supporting structure for these nerves. These can be from ectoderm or from the mesoderm also. Okay. So these are present everywhere in the central nervous system and the peripheral nervous system. So they're asking you to classify these neuroglial cells. So basically, under the neuroglial cells, you can say that you have the astrocytes, oligodendrocytes, glioblasts, and microglia. Then you have ependymal cells. Then you have satellite cells, Schwann cells, etc. Okay. So let me tell you what each of these do. We have detailed videos, like I'm telling you every time, we have detailed videos for each of these question and answers. So let's get started with astrocytes. So astrocytes will do what? Blood-brain barrier. Correct? So star-shaped. It has some processes radiating, covering the scapulary. So it will act as a blood-brain barrier. Next, oligodendrocytes. Oligodendrocytes, the job is to create the myelin sheath around the nerves in the central nervous system. Remember? Are you able to see this word, or is it too small for you? Oligodendrocytes. Then you have the glioblasts, which can differentiate and form other neuroglial cells. So basically, if there's any damage, these can help in repair also, right? Because it's forming other cells, I'm thinking. Then you have microglia, which acts as phagocytes. So basically, any debris, etc., is there, it will try to clear it out, correct? That is microglia. Then coming to ependymal cells, these line the ventricles, so they produce CSF. Okay, so this and all is mostly whatever I told you till now is central nervous system. Now coming to peripheral nervous system, satellite cells, remember, they help in regulating the environment. Satellite is regulating the environment. Okay, remember like that. Then Schwann cells, you know, they form the myelin sheath in the peripheral nerves, correct? And then there are a lot of other cells. That's what they are saying you. So this is the neuroglia classification that you have to write. Let me just tell you a little more here. Astrocytes, blood-brain barrier. Oligodendrocytes forming the myelin in central nervous system. Glioblast differentiates into other glial cells, macroglial cells actually. Microglia, phagocytic, we told you they will remove anything that is not supposed to be there. They will try to remove. Then these glial cells also provide mechanical support. They act as insulators so that they will allow this nerve impulse to transmit, right? Then what else? They store neurotransmitters. Then everything else I think I have told you, okay? So how's it going, people? We are trying to cover all the previous year questions, okay, from general anatomy. Whatever they asked in the last 5 years, we are telling you. So we have another few questions, okay? Just pay attention so that this will be a quick revision for your general anatomy. Classify fibrous joint with examples. Do you see what's written here? Asked multiple times. Multiple times they have asked you to classify fibrous joints with examples, okay? Actually, in this joints chapter, no, all types of joints are important only. Okay, now let's get started. What is joint? It's an articulation. between two or more bones or cartilages. Okay, so what is it? Articulation. The classification, you have fibrous joint, cartilaginous joint, and synovial joint. They have asked multiple times the classification of fibrous joint. They've asked multiple times the classification of cartilaginous joint, and even synovial joint you should know. Okay. Basically, fibrous joint. Okay, fibrous joint, the fevicol is the fibrous tissue. It is not fibrous cartilage. It is fibrous tissue. Okay, so it is mostly immovable or very, very little movable. Okay, the textbook classifies it as sutures, syndesmosis, gomphosis. Suture, syndesmosis, gomphosis. Three things you should know. Okay, so fibrous, what do you have? Suture, syndesmosis, gomphosis. All of them are fevicol is fibrous tissue. Okay, where do you see the sutures? In the skull mostly. Then where do you see the syndesmosis? Between your radius and ulna, in the middle radio ulnar. Here you have the interosseous ligament. So this is a fibrous joint, allows very little movement. And gomphosis is between your tooth and bony socket. Okay, the tooth is sitting here. So basically this is a, what is this? Gomphosis. Okay, this is a fibrous joint. Classification done, examples done. Under sutures, basically under suture you have many types of sutures. So let me tell you. You have the plain suture, you have the serrate suture, then you have the squamous suture, then you have the denticulate suture. Okay, then you have the wedge, that like this W, you write a W like this, and here you draw a, this is some wedge suture. Okay, so let me tell you, under sutures you have plain suture, serrate, squamous, denticulate, shin dialysis type, which has that wedge kind of a thing. So examples, if somebody asks you for plain, so internasal suture is plain. Then you have the parietal, interparietal is serrate. Interparietal is serrate. This one is squamous, that is the temporal. The temporal one, between the temporal and parietal is a squamous suture. Okay, then you have, let me go ahead. You have to cover these two, denticulate and shin dialysis. This one is lambdoid suture, which is denticulate, that is between the parietal and the occipital, right? Then you have the wedge, shin dialysis. This is wedge, like this something. Wedge, something like this. This is shin dialysis. Okay, this is another type of suture. Okay, between the vomer and the sphenoid. Okay, then coming to syndesmosis, where is it? It is between your radius and ulna, between your tibia and fibula. So this is connection is what? Interosseous ligament. Okay, this is a fibrous joint. Then you have the gomphosis between the tooth and the bony socket. Okay, these are all fibrous joints. Now shall we go to the next question, people? What are we looking at? General anatomy, previous year questions. Not just looking at questions, we're looking at answers also very quickly, correct? So you will be able to pass the exam. Microscopic feature of cardiac muscle, intercalated disc and branching. Okay, intercalated discs and branching. Okay, so here the answer is intercalated disc. It's a microscopic feature of cardiac muscle. Okay, just a few more to go. Don't get worried. Okay. Okay, so the next question is classify cartilaginous joints with examples. Okay, so cartilaginous joints means the fevicol is what? Fevicol is cartilage. Very good. So under cartilaginous joints, you have two types. You have the primary cartilaginous joints and the secondary cartilaginous joints. So easy, right? Yeah, let's see. Under cartilaginous joints, the fevicol is the cartilage, also called as amphiarthrosis. Amphi means neither here nor there or everywhere kind of a thing, right? That is the word. So it is between these fibrous joints which are almost immovable. Mainly their whole point is being immovable, and synovial is mobile. Okay. So when you have come to cartilaginous joint, they are amphiarthrosis. Okay. So we already told you there are two types, primary and secondary. Okay. Look at this. You have primary and here you have secondary. What do you mean by primary? primary means they mainly have hyaline cartilage. So you can see here between the epiphysis and the diaphysis. So this is that is in the metaphyseal plate, right? The growth plate, you have the hyaline cartilage. So this is primary cartilaginous joint. This is immovable. Okay, this is immovable. Coming to secondary cartilaginous joints, these have, with this hyaline cartilage, they have a fibrocartilage. Extra what they have? Fibrocartilage. So they'll have a pad of fibrocartilage which is actually compressible. So they become slightly movable. Okay. So what are the examples? You have the pubic symphysis, intervertebral discs, etc. For what? Secondary cartilaginous joints. Okay. So let's get back to our classification. So here you can see, people, cartilaginous joints joined by what? Cartilage, that is the fevicol. It is also called as amphiarthrosis. Here you have primary and secondary. Primary cartilaginous joints are having hyaline cartilage. They are immovable, like between the epiphysis and the diaphysis, that is in the metaphyseal plate, that is the growth plate. Then you have the secondary cartilaginous joint, the symphysis, which has extra fibrocartilage compressible pad, so they are slightly movable. Example is pubic symphysis, intervertebral disc, etc. Okay, so for primary cartilaginous joint, there is one word, synchondrosis. For primary cartilaginous joint, synchondrosis. For secondary, you have symphysis. Okay, some extra words. So primary cartilaginous joints, some more you should know. The between the epiphysis and diaphysis, we already told you. Then you have the spino-occipital joint, that is somewhere inside your head, spino-occipital joint. Then you have the first chondrosternal joint, and then all the costochondral joints. Okay, so the first chondrosternal joint and then all the costochondral joints. These are primary cartilaginous joints. That means they have hyaline cartilage. So what happens? These all will later become calcified and they will become what? They get replaced by bone. So this is called as synostosis. What will happen to this primary cartilaginous joint? They'll become bone after some years. Okay, so that is why when you take X-ray of a person who is below 18, you will see this gap between epiphysis and diaphysis. But in me, if you take this X-ray, you will not see gap because this cartilage, that is hyaline cartilage, primary cartilaginous joint, has become bone. Okay, so primary cartilaginous joint importance you understood. Next, coming to secondary cartilaginous joint. So these are not going to ossify and all. These are permanent actually. What is there? Compressible pad, fibrocartilage. In addition to the hyaline cartilage, there is fibrocartilage, compressible pad. So where and all will you see this? Pubic symphysis between this manubrium sterni, that is between the manubrium and the body of the sternum, you will have this fibrocartilage, and then also between the intervertebral disc, I already told you. So 3 examples are there for your secondary cartilaginous joint. Okay, they permit limited movement because of the compression of this pad of fibrocartilage. How's it going, babies? Are you going to pass a general anatomy theory exam? Okay, hopefully. Next question, please. Differentiate pneumatic and sesamoid bone with examples. Okay, let's do this. Pneumatic bone means what? Scroll down a little. I'll just arrange this image here. Pneumatic bone and sesamoid bone, they want you to compare. Both are bones, that much you know. Pneumatic bone means it has air space. So you can see here, this is what? Maxilla. So it has air space, so it will make your head light, right? And it will also allow some circulation of air, and it will allow some voice resonance. So that is the whole point of pneumatic bone. Air space is there. From birth, this bone you will have. It will reduce the weight of the skull, voice resonance, air conditioning. Okay, so that is what is the job. What are the examples? Maxilla, sphenoid, ethmoid, frontal, and even temporal, which has the mastoid air spaces. Okay, so these are the examples. Maxilla, sphenoid, ethmoid, frontal bone, and temporal bone. In temporal, it is the mastoid air spaces. Okay, so this, as it is present from birth, you can see it in the X-ray. So this is pneumatic bone. When it comes to sesamoid bone, people, sesamoid bone has no air spaces. That is not the whole feature of sesamoid bone. The whole point of sesamoid bone is that it forms in the tendons at the joint. Okay, so at the end of long bone, what do you have? You'll have one joint, correct? So one muscle will be there, like this is knee joint. Bring the knee joint here, please. I will explain properly. So here you have the femur. So here you have the femur, correct? So what do you have here? Tibia. This is the fibula. These are the bones. Here you have one muscle. You have 4 muscles. So those 4 together attach here to the tibia, right? So this is the quadriceps tendon. So in this tendon, one bone will form, and the name of this bone is the patella. Okay. So this bone, sesamoid bone, forms in the tendon of this muscle at the joint, at the end of long bone. Okay. The whole point of this bone is that it will reduce the stress on this muscle. Okay, on this tendon. So example, very famous example is patella. So its airspace is not that we just wrote because of comparison that they have asked, because we have written that point here. So similarly, at that same place we have written here, but that is not the main point. Basically, sesamoid bone forms in the tendons at joint, and it removes the stress from the tendon. And examples are patella in your knee joint from the quadriceps tendon, and then you have the pisiform in your carpal bones. Okay, that also you can write. Then basically, when will you see in the X-ray? After puberty only, because it has to form, right? It will form and then it will appear in the X-ray after puberty. So you can use it for age determination also. How's it going, people? Too much? Just a few more, okay? General anatomy questions we will cover off for you, okay? So look at this. Define sesamoid bone with 2 examples. You already have done this, so it will not take time. Just listen. Sesamoid bone is small bone. Where is it found? In the tendon near joint surface, right? It will ossify and appear in X-ray when 12 to 13 years. Okay, so basically it wants to remove the stress from the tendon. Okay, what are the examples? Patella, we told you, in the quadriceps tendon at the knee. Then you have the pisiform, which forms in the flexor carpi ulnaris tendon. Okay, in your wrist joint in the carpal bones, you can see. So you can use it for age determination. At what time will you see? After puberty, 12 to 13 years. Okay, so there are a lot of other sesamoid bones, but they have asked how many examples? 2 examples. Okay, one more I will tell you. Head of first metacarpal also, there can be a pisiform which, there can be a sesamoid bone which forms. Relax. So much I'm telling you. Sesamoid bone can form at the head of first metacarpal also. It doesn't have any special name. Okay. Even sesamoid bone can fracture, people. Okay. Now let's go to the next question here. List 3 differences between cartilage and bone. Okay. Cartilage and bone. 3 differences they've asked for 3 marks. We'll give you more only so that you'll be able to write. Both are part of skeleton. Both are having connective tissue. Both have collagen also. Okay. But in cartilage, the type 2 collagen predominantly, and bone will have type 1 collagen predominantly. Cartilage will have chondrocytes. What will cartilage have? Chondrocytes. What will bone have? Osteocytes. It will have osteocytes. Bone will have calcium in the matrix. Calcium carbonate, calcium phosphate, etc. will be there in the matrix. Okay. But cartilage will not have calcium. That you can write. Okay. Now coming to the differences that the textbook has given. Cartilage is firm. Bone is hard. Cartilage has chondritin. Bone has ossian. Calcium salts are present in bone's matrix. The bone has nerve supply, vascular, that is blood vessels, right? So bone can feel pain, correct? It has blood supply. But cartilage, most cartilage types are not having nerve supply, and they are avascular in nature. So they don't feel pain. Okay, but not all cartilages are same. Okay, but some of them, most of them, they don't have nerve supply, so they are insensitive to pain, and then they are avascular. So how do they get nutrition? By diffusion. So they don't have blood supply, so they'll have to take the nutrients by diffusion. Okay, cartilage. Then who has bone marrow? Say, people, you only say. Bone marrow is present in whom? In the bone. Very good. So bone marrow will make RBC, WBC, platelets and all. It will make. So bone has so many functions. Then who can grow? Both can grow, but bone will grow only by opposition. That means you have to bring bone together like this or something. You have to, bone will grow by surface deposition. Okay. How does bone grow? Only by opposition and surface, that is by surface deposition. Okay. But cartilage can grow from within. Cartilage can grow from within. Okay. Some type of cartilages, no, they can, in which the chondrocytes can die and then they can become bone-like, okay, with deposition of calcium, okay. What are we talking about? The differences between cartilage and bone. So in the types, you can say types of cartilage, you can say hyaline cartilage, fibrocartilage, elastic cartilage. Types of bone, you can say compact bone, spongy bone. Spongy also has one more name, cancellous bone. Okay. So when you come to the differences by microscopic structure, focus people, relax also. Take a deep breath. When you come to cartilage, the cells are what? Chondrocytes. These chondrocytes are within lacunae, and there is matrix. And this matrix will have what? Fibers. Okay, so it can have fibers. Fiber in the matrix. Okay, this is cartilage, microscopic structure. Now coming to bone. Bone microscopic structure, I will tell you mostly of the compact bone. So the compact bone, which is here, it will have what? It will have these osteons. In middle of these osteons, you have these Haversian canals, okay, with all the blood supply. And then longitudinal section, you can see the Volkmann's canals, right? So what are these circles? This entire thing, this is osteon. And in this, you will have the osteocytes. Okay, so this is the, if you want to write more in terms of the differences for like 5 marks, then you can draw diagrams also. Okay, there's one more word here, no, that canaliculi, that also you can write. Okay, now moving on, functions difference, you say cartilage. What will cartilage do? You have articular cartilage, right, in the joints. So shock absorber, they will resist compressive forces, etc. Then you have cartilaginous joints, like primary cartilaginous joints and secondary cartilaginous joints, which we have explained a lot, right? Then coming to bone, what are the functions of bone? Shape, support, weight bearing. Then it provides surface for attachment of muscles, etc. It will do your actions, lever, it will act as a lever for your muscular actions. It can also protect your organs, right? And then bone marrow will manufacture RBC, WBC, platelets, everything. Then what else? Okay, then let's move on. Some other differences, functions they have told you. Let's move on to the last one here. Looks like no, one more slide is there. Examples of cartilage, thyroid cartilage, such a big one sitting there. It is not a bone, remember. Then coming to bone, we have 206 bones. So many bones you can name. Humerus in the arm, femur, longest bone, etc. Right? Then coming to clinical anatomy, if cartilage, what and all problems you can have with cartilage, like intervertebral disc prolapse can happen. Then you can have osteoarthritis because of degeneration of cartilage in the joints. Then coming to bone, you have fracture. Everybody will say bone, clinical anatomy means fracture, bone marrow biopsy, you can say, of the hip bone, right? Then coming to tumors, bone tumors. Look at this. If you have chondroblastoma, then equivalent to it, you have osteoblastoma. If you have chondrosarcoma, you have osteosarcoma, which is malignant. Okay. So this is the clinical anatomy also we told you in the differences between cartilage and bone. So this, people, covers all the general anatomy questions that have been asked in the last 5 years in RGHS University. Apart from this, I would like you to read synovial joints classification also. Types of synovial joints also, it's better if you look at. In terms of diagram, I think histology or even otherwise, lymph node structure you should know. So this is afferent lymphatic vessel, efferent lymphatic vessel, and then here you have to show artery, vein, all that you can show. And what else will you show here? You have to learn lymph node diagram. Germinal center, very important, germinal center.